Welcome back to the show, everyone. Here to tell us what our options are if we happen to have one or more missing teeth. I welcome Dr. Peter Abbas to the show.
Thank you for having me again. Nice to see you again.
Nice to see you as well. I really enjoyed our last interview, and this interview is going to have a lot of important talking points because it happens to the best of us. All of a sudden, for one reason or another, trip or a fall or something, we have missing teeth.
Absolutely.
I've seen it happen.
Absolutely.
I've seen the consequences.
Sure.
And I'd like to talk about those as we move through our interview. But first, you're really local here, right?
Yes, yeah. Located in the Taj Mahal building right in the corner of Paseo de Valencia and El Toro Road. It's the big white building, the white pillars, black glass, and the shuttle goes to our building regularly. I've been there for 11 years. I've been in practicing dentistry for 20 years now. Wow. I grew up here in Southern California, went to school in Northern California, and have been here now practicing for 20 years in Orange County, actually, right here in Orange County locally. So, and 11 years right here in the Taj Mahal building. So it's been a great run. I have a lot of great patients that live right here in the village as well. So. That's
great. And you offer complimentary consultations,
correct.
Right?
Absolutely.
As well as complimentary
second opinions. Yeah. So if someone wants to come in, and maybe a previous patient of mine that went somewhere else, or vice versa, anyone wants to come in for just a quick chat, I'm happy to do that, just to go over options and just review things with them, just to make sure everyone's making the best decision possible. Absolutely.
Right. So today's focus is going to be on teeth replacement. So if somebody is missing just a tooth, tell us what their options are.
So there's three major options available to us in dentistry right now to replace teeth. The first would be a removable partial denture. Basically, something comes in and out of someone's mouth. Usually I reserve that for that's the least desirable for most cases. Sometimes it makes sense when there's multiple missing teeth and finances are concerned, that may make sense. The next option I like to review with patients is something called a fixed bridge, okay, also known as just a regular bridge. That one is the one that's cemented, not the one that's removable.
So, so it's permanent.
It's a permanent cemented bridge. And it works great for 1 to 2 missing teeth. And it's a nice option in many cases. Sometimes it makes the most amount of sense. The challenge that comes with the fixed bridge is the tooth behind and the tooth in front need to sacrifice some tooth structure in order to support the false tooth in the middle.
Oh, wow.
So if those teeth, for example, have nothing going on with them, no fillings, no crowns, nothing at all, then it's a challenge because now we're having to remove and sacrifice some healthy enamel for the purposes of replacing a tooth. So
doesn't sound ideal.
Yeah, it doesn't sound ideal. Sometimes it makes sense though. Let's say, for example, there's a crown of the tooth behind, a crown of the tooth in front. Then it kind of makes sense. You're not really having to do a lot of sacrifice. The best option typically is a dental implant, okay? A dental implant is an artificial root that gets placed into the jawbone.
That would be the screw.
Titanium. Yeah, it's kind of like a screw, kind of looks like a screw. And it's an artificial root that gets placed in the jawbone, and then we build a tooth on top of it. That is the most ideal in most cases because we don't depend on the neighboring teeth in any way, shape, or form. It's a self-standing restoration. Right. So it does quite nicely there and really helps patients. And there's lots of different ways to utilize these implants. It could be a single tooth or it could be multiple, which we could talk about in a few minutes.
And you can match that artificial tooth to the real teeth,
yeah,
right? So
absolutely.
You can't even tell.
Absolutely. We really do our best to try to make it as harmonious as possible, blend in as well as possible. We work at dental laboratories to make sure, I even do something like if it's in the front, I do something called custom shade matching where I actually send the patient to the dental laboratory so the dental laboratory ceramist, the artist who makes the tooth, can actually see the color and the character. Sometimes you can't pick that up in a photograph. Sometimes it's really important to have the ceramist see the tooth so that the patient has the most realistic outcome.
Right. And then, so we were talking about one missing tooth. You talked about, you touched on a few missing teeth.
Absolutely.
And then that's when you would go into that partial denture, right?
Partial denture, yeah. Partial denture is better for multiple missing teeth or someone who doesn't have enough stability for an implant, or maybe maybe they've exhausted all their options. Let's say, for example, they're missing all of their teeth in the back, all their molars, for example, and they just don't have enough bone. They've had atrophy of the bone. A partial denture may be the only option that a patient has. But it's something that is definitely beneficial rather than having nothing at all, for sure. Let me go back a little bit. So the consequences of missing teeth. So once a tooth is gone, the jawbone, okay, we call it the alveolus, the jawbone has no purpose. So what tends to happen is the bone actually atrophies down. It actually shrinks back like a muscle that's not being used.
Right.
So it's really important if someone's going to have a tooth removed for whatever reason, that we really try to consider the options and what's going on there as soon as possible, especially if they're considering a dental implant. And the reason being is I tell patients that dental implant looks kind of like a screw. Your jawbone is, think of it like a piece of wood. You need to have enough wood for the screw.
Right.
Okay, so
Right.
if someone has a tooth pulled out and waits 2, 3, 4 years and now comes back and says, I really want to get a dental implant now, it may be compromised because that bone may have shrunk back. Not to say it's not a possibility, but it makes it much more difficult.
I've had a personal experience with this where my boyfriend's son had knocked his tooth out as a child, and it eventually died and fell out as an adult.
Yeah.
And he thought it was funny
Yeah.
to have a missing front tooth. He got lots of attention for it.
Sure.
And he's really tall, so everyone thought he was a
Hockey
Ducks player.
Yeah.
But eventually it wasn't so funny anymore.
Yeah.
And it got really unfunny
Yeah.
when we had to dump, over $10,000 back into that mouth just to shift the teeth back to where they were.
Yeah.
To put that implant in. So it's really, really important, as you said, address this immediately.
Really,
because
yeah.
there are severe financial consequences
Absolutely.
if you don't. And it's not anything to play around with.
Yeah, there's a domino effect that happens. Typically, most people end up losing teeth not because of an injury. I mean, that happens, of course, but it's typically due to either gum disease or cavities that have just gotten out of control, or a tooth just breaks down considerably.
Really?
And then, like I was saying, it can become somewhat of a domino effect. You end up losing a tooth, you don't address it, you don't replace it. What ends up happening is the tooth behind it starts to shift in place of it. The tooth above it starts to shift down, looking for its downstairs neighbor. And now we have this shifting that occurs,
Yes.
and there's this domino effect. And now the bite is off, and a lot of other things that happen. So again, 70% of adults in the United States are missing at least one tooth. So and we're not talking wisdom teeth either. Those are aside. We're talking just normal standard dentition.
Right.
So it's important we address those missing teeth when they do arise.
Absolutely. Now tell me, when you actually use the screw component to go into the bone, does that stimulate any type of bone growth?
Absolutely. So it basically helps stimulate the bone. So in a situation where someone has to have a tooth pulled out, the ideal situation would be this. I work really closely with an oral surgeon, a local oral surgeon here, and the way it would work is the oral surgeon would remove the bad tooth. The day that they remove the tooth, they typically fill the space that the natural roots were taken up by with some artificial bone. And there's a lot of different sources of that, which the surgeon would be able to go over with the patient. And then we need to let it heal and mature for a few months. And then once the bone is mature, then we're able to go back in, create a small channel in the jawbone, place that dental implant. Okay,
Right.
That dental implant needs to stay in there for a few months to fuse and harden with the bone, and then after that, we're able to build a tooth on top.
Yeah, so it's something to note that this is not a quick process.
It's
right?
It's
this
not.
probably takes about a year total,
Yeah.
as long as you don't get infection. Because I know another
Absolutely.
friend who had same thing, front tooth. She knocked it out. And when they did that bone graft, she got massive amounts of infection.
Yeah, it has to be done properly. That's why I work really closely with an oral surgeon who has additional training in this whole surgical process to make sure we have the best outcome possible. That's my philosophy. I really want the best of the best for our patients, especially when it comes to something that's implanted in your jaw. We want to make sure that it is as high quality as possible with the best possible outcomes.
Right.
Absolutely.
Dr. Abbas, thank you so much for joining me today.
Of course,
Appreciate
my
all your
pleasure.
valuable information.
Yeah, thank you
and
so much.
Visiting with us.
Absolutely.
All right, everyone, if you've got any missing teeth, go see Dr. Abbas. You're watching This Day on Village TV. We'll be back after these messages.